One of the questions I get most in therapy is, how long will I be here? How many sessions do I need to have of therapy before I'm doing better? Well, the answer might surprise you. Let's talk about it. Hi, my name is Shara Ogilvy, and I'm a mental health counselor. I've been working with individuals for 15 years, and I absolutely love it. Myself, however, as a client, when I was in my early 20s, I totally failed in therapy. I did not know what to do, what to ask, or what to say. So I'm doing this series to help you be successful in therapy. And today is one of 6 how to be successful in therapy. So, all right, the average number of sessions that a client will have in therapy in their lifetime is 20. That's just statistics. Statistics lie. Statistics take averages. So yes, the average number is 20 for a round of therapy, but that doesn't have a whole lot to do with you and how long you're going to need in therapy. I have had clients be successful with 1 session or 3 sessions. And I have clients that I saw over the course of, I don't think I have anybody that I began with. So I haven't seen anyone for 15 years by any stretch, but I have had people that have popped back and forth and I've worked with for upwards of 7 or 8 years. So those are the 2 extremes, is 1 to 3 sessions and 7 to 8 years with breaks, with time in between. Or I've probably had a couple of them continuously for 5 years, maybe a small handful. But that is not the norm. Neither of those is the norm. So what is normal for you? What are you going to need? Well, here's a rule of thumb, and that is frequency, intensity, and duration is going to predict your length of therapy, the frequency, intensity, and duration of your symptoms. Let's say depression is something that you've been dealing with. Frequency is you have it half of the time, 3/4 of the time. The intensity is it's moderate. And the duration is when you've had it all of your life, as long as you can remember. Since you were 5 years old, you remember being depressed. Well, you're probably going to need to be in therapy for a while because it's been with you all the time. You have it most of the time, and it's moderate, maybe even more than moderate. So that gives you a clue. Let's say it's depression and the frequency is you've only had it once. The intensity, it was severe, but you only had it for 3 weeks. Okay, you're probably not going to need a ton of therapy. Yeah, we want to look at the severity and we want to make sure we get the holes in the system patched up. But most of your life has been very functional, so you're probably not going to be here too long. Now, those are oversimplified answers, of course, but it gives you kind of a framework to know, and this works for anything healthcare-wise. If you have any healthcare issue that has been with you a long time, it occurs frequently, and it's severe or at least moderate, then you're probably going to be at it for a while. And so it would be unrealistic to go to a healthcare provider and say, I only want to see you for 4 or 5 times, but I've had this forever and I want it to be fixed. Not realistic. But again, if it's a small, short-term item, then that's probably more what is called an adjustment issue, and that is fairly quick to get in and out the door with. I had a client a few months ago who she was in and out the door in 3 visits. And why is that? She naturally is a very, very resilient person, responsible, cheerful, and in general, very happy. She has never felt depressed in her life. She just doesn't have depression. I mean, we all have bad days, but that's not what we're talking about. She experienced a breakup that was upsetting, and she just wanted somebody to talk about it. She got a few things off her chest. I gave her some skills, a couple things to communicate to him, a couple self-care things to try. She implemented it, worked so beautifully. And she's like, I don't really need to be back. And I'm like, I don't really think you need to be back. Individuals that are lower on, let's see, what's the word that I'm thinking of? Oh, it's escaping me. That are lower on the tendency to be, it's neuroticism, excuse me. I finally remembered. Neuroticism. If you're lower on that neuroticism scale, you're not going to need therapy nearly as much as someone who's higher on the neuroticism personality scale. And what that means, neuroticism, it's just a stable trait of personality that you are born with. You cannot change it. You can modify it, but you cannot change it. And that is your tendency to be very, very sad or upset or depressed or worried or overthinking. Those traits are trait neuroticism. And it doesn't mean what you think it means. It doesn't mean you're mentally ill or that you have a personality disorder. That's not what it means. It just means that you're someone that tends towards those feelings, those negative feeling states more than some other people. It really is what you're born with, and you have to learn how to navigate that. And if someone is not born with very much neuroticism, then they are, no matter what comes their way, they're going to just kind of have an easier way of it emotionally. But if you are born with a certain amount of neuroticism, especially a lot, no matter what comes your way, you're going to overthink it. You're going to stress out about it. It's going to be more upsetting. And so if you're someone who has more of that trait neuroticism, then you're just going to need more support. If that's therapy, if it's talking with friends, whatever that looks like, you're going to need more support anyway. All right, so I hope I've kind of made my point that it just really depends on your history, how long your issue has been bothering you, how intense it is, and how frequently it shows up. And also a little bit about your personality trait. If you tend to be a little bit more neurotic, and no judgment there, I'm very neurotic. If you tend to be more that way, you're going to need more support, and therapy is one of those supports. One little thing that I want to throw out there, though, to keep in mind is that when you are in therapy, the real work, in my opinion, for most clients, doesn't start until after about 3 sessions. Now, with that client who I only saw for the 3 sessions, we got the work done quickly. There wasn't really a lot of complications in her story, and it was what we call as therapists an adjustment disorder, meaning some quick little thing that just needs dealt with, and then we all move on. But the 3-session rule for most clients that's going to stick around longer is that it takes about 3 sessions for me to actually hear enough of your story and for you to kind of get to trust me so that we can vibe together to where we actually kind of have an idea of where we're going. So if someone were to ask me how long is this going to take, I wouldn't have a perfect answer for them until I'd at least met with them 3 sessions, and even then it can evolve as you go. The key is your agency. If you feel like you want to be done sooner, you need to be vocal. If you feel like you are enjoying something a little more open-ended and you really appreciate that support to just come have check-ins, you need to be vocal about that as well. Some therapists are more what's called solution-focused, meaning they want to say you are going to be done in 12 sessions and that is what we've got. And some are more open-ended and psychodynamic, saying I'm just here for you to bounce off your crazy ideas and let's see where it takes us. And so that may be a conversation to have with your therapist of which are they angled towards and do they have a strong opinion. I do both. I try to lay that out there for the client. If they want to be more solution focused, let's be very clear that we only want to meet together for say 15 sessions. And so that I can have them doing behavioral logs and check-ins, and we know exactly when we're meeting those goals. If they feel like they need to explore more, be more open-ended, say they're working on a lot of childhood trauma, then I can say we can take it very intuitively. And so again, part of that, how long am I going to be in therapy, has a lot to do with you and your desires and what you want to get out of that. If you're looking for a very specific outcome, or if you're looking for, obviously you want those outcomes, but also something a little more open-ended. All right, I hope this is helpful. And I do want to put out there that I've made a download with some tips on what to get the most out of therapy, and it covers all the topics that I'm going to be covering in this 6-part series. So see the description for that playlist and also to get that download, and I'll see you next time.